Heart failure is a condition that occurs when the heart cannot pump enough blood to meet the body's needs.
Today, we will be discussing more about it.
The heart is a complex organ that consists of 4 chambers and a network of blood vessels. It works by contracting and relaxing to pump blood throughout the body. The causes or etiology of heart failure can be caused by a variety of factors, including high blood pressure, coronary artery disease, and diabetes. Other risk factors include smoking, obesity, and a sedentary lifestyle. The pathophysiology of heart failure involves the weakening of the heart muscle, which can be caused by a variety of factors, including damage to the heart muscle from a heart attack, high blood pressure, or valve disease. The clinical features of heart failure can vary from person to person. Some common symptoms include shortness of breath, fatigue, and swelling in the legs or ankles. In severe cases, it can lead to coughing, chest pain, and fainting. The diagnosis of heart failure typically involves a combination of tests, such as an electrocardiogram, a chest X-ray, and blood tests. The management of heart failure involves a combination of lifestyle changes and medical treatment. This can include quitting smoking, adopting a healthy diet and exercise routine, and taking medications to lower blood pressure and improve heart function. In some cases, surgery may be necessary to treat heart failure, such as a heart transplant or implantation of a left ventricular assist device. Heart failure is a serious condition that requires proper diagnosis and management. By understanding it better, we can take steps to prevent and treat it. Remember to take care of your heart and make healthy lifestyle choices. Thank you for watching. Please do like and subscribe to our channel for more medical content.